and good afternoon, and thank you for joining me for today's Lunch and Learn. Now, today we're going to be talking about proton pump inhibitors, commonly known as PPIs, and they are sold all over your grocery stores, your pharmacies. You can get them in the big box store, and they're readily available, but they're super, super dangerous. And so we're going to be talking about that and what you can do instead. All right, so a proton pump inhibitor is a popular class of heartburn drugs, but the studies have found that these drugs are linked to stomach cancer. Now, I had a friend because she's passed away. She had stomach cancer and they had to remove her whole stomach. And so she was telling me this at a meeting that we had a few years back, and I wondered, how do you even consume any food if you don't even have a stomach? Because your stomach is the organ that dissolves the food because of hydrochloric acid and that kind of thing, so that it can be in small enough increments that your small intestine can absorb it. And so you don't want to have stomach cancer. Nobody wants to have any kind of cancer. But this review indicates that prolonged use of PPIs exceeding 3 months is significantly associated with elevated risks of stomach cancer, while shorter-term usage appears to pose a comparatively lower risk. PPIs are the drugs that lower stomach acidity, and they work by binding irreversibly to the proton pumps, proteins in the stomach that release protons, a component of stomach acid. This action prevents the secretion of the protons. Now, these drugs are commonly prescribed to treat acid reflux, ulcers, GERD, heartburn, any of those kind of things that, like I say, they're over the counter, they can be prescribed. And in some cases, it is important to take them, but you don't want to take them for a long time. In the package insert, I think it says not to be taken for longer than 2 weeks. And so I know people that have taken these for like years and years and years and years. And so we don't want to be that person, because that is the person who has the increased risk of stomach cancer. So we don't want to do that. All right. PPIs are sold over the counter. I'm going to say some of these words, and they may be right, they may not be right, but we're also going to give you the brand name. So omeprazole, which is Prilosec, esomeprazole, which is Nexium, lansoprazole, which is a Prevacid, and some requires a prescription, such as Rabrisol. I've never even heard of that one. It's sold under the brand name of Akefes, and propranolol, Protonix, and lansoprazole, Dexilant. Never heard of those. So these drugs increase your risk of stomach cancer and polyps. And so you don't want to have polyps, because polyps are a cancer precursor. So the authors reviewed several papers linking the PPIs with cancer risk and found the link between PPI use and stomach cancer. No other cancers were indicated in these studies. One of the studies, they cited evaluated data from 2,400 records, and found that long-term use from between 1 year and 3 years was associated with a 1.5 and a 2.4-fold increase of stomach cancer, respectively. Now, you might not think that that's a huge increase, but it is. And so we are trying to protect ourselves from cancer. We're trying to protect ourselves from all of the aging processes, right? We don't want to fall apart. We want to live long and live strong. And so we want to make sure that what we're doing is everything that we can do in order to enhance that. Other research followed 3,271 patients who were given PPIs after a H. pylori infection. They found that long-term PPI use was associated with a 2-fold increase in risk of stomach cancer. Now, and the study also found with women, all right, that PPI use was associated with a reduced risk for breast, ovarian, and cervical cancer. However, the authors caution against using PPIs for cancer treatment, citing that the studies found worse outcomes and higher mortality risk for those women. So that's kind of a mixed bag. I've never heard of using PPIs as a cancer treatment. However, if that's in your history, your family history, and that kind of thing, you might want to rethink that. You might want to talk to your doctor about that, because the researchers found that that actually increased your risk of mortality and you had worse outcomes on that. So why is this risk a big deal? Well, there's several reasons why it is. The PPIs contribute to cancer because they disrupt the gut microbiome by increasing the pH of the stomach. Now, I just want to show you this. I hope it's not backwards, but I know sometimes on live it is. So here is the pH chart. Let's see if I can get this. Feel like the guy, on that TV show. So here's your pH. So hydrochloric acid right here is here. Your stomach acid is a 1, okay? We want your normal pH to be between 6.4 and 6.5 down here. So when your stomach acid is here at a 1, using the PPIs increase your stomach acid, which means you go down the chart here. Some people have even come in with a 7, which we don't like. Some have come in with an 8, which we really don't like. So why is that a big deal? Because the lower your pH is, the more acidic it is. You have acid pH in your stomach so that you can break down the foods you eat so that you can absorb the nutrition. Also, though, stomach acid kills bacteria. It kills parasites, right? And so we want to make sure that we're not having those things enter into our system through the food that we eat. And so this is one of the reasons that we have the pH to be a 1, which is very, very acidic, all right? So the PPIs increase your acidity. Now, there's really not quite the right way to say it, because the lower your number, the more acid you are. The higher your pH, the less acidic it is. And so the PPIs raise your stomach pH, okay? And so that is not good for digestion. This promotes the growth of harmful bacteria that produce the carcinogens. So if you're someone who are using PPIs, you need to understand that that may not be your best option. I know nobody likes heartburn. I know that esophageal reflux disease is not a great thing. We have people in our family that suffer from that, and it's quite upsetting, and it's quite painful in some cases. And so, yes, these drugs do help, but what we don't want to do is take these drugs every day long term because of the side effects of cancer and all those other things, okay? PPIs may result in hypergastronemia. Since they increase the stomach pH, the stomach increases the production of gastrin, which is a type of protein in the stomach. Gastrin stimulates the growth and activity of certain stomach cells, and the higher the concentration of gastrin, the greater the cell activity and proliferation, which means your risk of cancer has just increased, and that's not what we want. We want to eliminate cancer. This is why those surgeries that go in and mess up your stomach are so detrimental to your long-term health. Your stomach is an organ that is specifically made in such a way that you've got different secretions at different parts of the stomach to help break down the food. So when you have a gastric bypass or you have a gastric sleeve or whatever else they do these days, you're messing up the way that your body breaks down your food, and when you do that, you cause all kinds of problems in there. Apart from the proposed mechanisms, the PPIs also have a wide range of side effects. The increase in stomach acid, pH, can lead to indigestion, nutritional deficits, intestinal bacterial overgrowth, and other gut problems. It's also linked to infections such as H. pylori and C. diff. Now, I want to show you something else. So this is one of my favorite graphics. When you digest your food, you absorb your nutrients, you have energy repair, and you have health. Okay? When you do not digest your food, you've got toxicity, inflammation, and imbalance. When you have this, you have all of these opportunities for sickness and disease. All right. So heartburn is one of those things that you get when you have all of this messed up in your gut. So we don't want to do just a PPI unless you've been to the doctor, you've been to the endocrinologist, they have found that you are ulcerated in your esophagus. We don't want that, okay, because that leads also to esophageal cancer. We don't want that, but that can be healed in 90 days. Okay, we've seen that healed in 90 days with those prescriptions. So we're not saying that we never want to take those prescriptions. What we're saying is if we have a real problem where those drugs are needed, that's fine, but we want to do that for a very short amount of time. Like I said, 90 days. After 90 days, the longer you take them, the more you compound the problems, and that's going to be leading you up to an increased cancer risk. So H. pylori, which you can get, so let me try and give you a little stomach anatomy lesson. So your esophagus comes down, goes right under the left breast, right under your heart, hooks to the stomach there. That's called your cardiac sphincter. There's another name for it, but that's what we call it. Then your tummy goes, across, and then it is connected with another sphincter to the small intestine, and that is called the pyloric sphincter. So H. pylori is right here in the right side of your tummy where your stomach connects to your small intestine in that sphincter. Now, H. pylori bacteria is a corkscrew bacteria, so you know what a corkscrew looks like. It burrows down into the mucus layer of your gut, and it is very difficult for antibiotics to get to it. So the doctors will give you antibiotics if you have that. We look at it and take care of it in a different way. So if that's something that you've had, then that's something that we need to talk about. The antibiotics don't always do the job because they can't get through that mucus layer. That's why they burrow down in there, because they want to be protected. Now, if it's left there for long enough, that bacteria actually will eat up the mucus layer, and that's when you get the ulcer. You've got your bare flesh there in the stomach. You've got that hydrochloric acid, which is really, really strong acid. It's a 1 on the pH scale, and that is why you have those pains when you're eating or when you're anxious or whatever, because of the ulcer there. So H. pylori is a real thing. It is very hard to get rid of with antibiotics, but we've got things that we can do to help you with that. So H. pylori bacteria survives and proliferates when your pH is 3.5 to 8. Normal stomach pH is a 1. So when it raises just to 3.5 to 8, then you're going to have those issues. A healthy stomach acid environment is a 1 or a 2. Now, C. diff infection is usually transmitted through food. However, the risk of infection can rise if the stomach acid is not acidic enough to kill the bacteria. C. diff also, we see it when people are on antibiotics for years and years. All right, you've got an infection, you take an antibiotic, it doesn't do anything, so you take another antibiotic, it doesn't do anything, so you take another antibiotic, and it doesn't do anything. What you're doing is you're killing all of your microflora in your gut, and so this C. diff is a different kind of bacteria, and it just proliferates, and it is very, very deadly. You can die from having this infection, so we don't want to do that. We don't want to get into that state. According to the review, the PPIs are also associated with an increased risk of dementia, bone fractures, osteoporosis, liver and kidney disease. So this is really serious, people. We don't want to have that. We don't want to have any of that. People with GERD and indigestion can replace PPIs with less potent alternatives, including antacids and H2 blockers, once their underlying physiological problems are better managed. Now, just to give you a little bit of perspective here, my late husband died of cancer treatment. He had esophageal cancer. And they went in, they did all the things, and they did whatever they did, removed whatever they could remove, but it had already moved to his lymph nodes. When you have a lot of indigestion, you don't want to ignore that. So indigestion, esophagus, under the left breast hooking up to the stomach, you've got that sphincter. Think of a rubber band. It opens to let your food in, and it closes to keep the contents in your stomach. That sphincter can get stretched, just like a rubber band can get stretched, okay? One of the things that does that is being overweight. If you have a lot of visceral fat, now visceral fat covers your abdominal organs, all right? When you sit down and you have a lot of visceral fat, that visceral fat pushes everything up. It pushes your stomach up. And so when it does that, that sphincter doesn't stay where it's supposed to. It goes up the esophagus, and that it stays open. So when you have acid reflux, that acid comes from the stomach back up your esophagus, and if left long enough, that's going to cause esophageal ulcers. Now, esophageal ulcers can turn into a disease called Barrett's syndrome. Barrett's syndrome can then turn into esophageal cancer. We do not want this. We have seen people who have had esophageal ulcers, and they do an endoscopy at the GI doctor, right? You have to be sedated and that kind of thing. They stick a tube down, and they take pictures of your esophagus. And if your esophagus is ulcerated, that is the perfect scenario for you to do PPIs, but you only have to do it for about 90 days. That gets all your stomach acid resolved. It's not coming up anymore, and those ulcers are able to be healed. So thank you, Jesus, for that. What you have to figure out is, why do you have that reflux in the first place? Are you overweight? Do you have a hiatal hernia? All right, those go kind of hand in hand. And so you want to make sure that you don't have that, because you don't want that stomach acid coming back up. However, you don't want to have the mindset of, oh, I get indigestion a lot, but if I take these PPIs, then I don't have to worry about it and I can eat whatever I want. No, that is not the right mindset. That is a lot of people's mindset. I talk to people all the time about that, but that is going to encourage you to have all these kind of issues with the stomach. And so I looked up H2 blockers, because I really hadn't ever heard of that before. So you want to Google that. It's very kind of complicated, but these are less potent drugs that you can get, and they help with the acid reflux, but they do not change your pH of your stomach that much, okay? Scott Rollins from the Integrative Medical Center of Western Colorado said that although PPIs can be highly effective in controlling potentially dangerous stomach ulcers in patients, they come with cumulative adverse effects. Compared with antacids and H2 blockers traditionally used to alleviate heartburn, PPIs are slower to activate and last much longer. So antacids increase the pH of the stomach immediately upon entering the stomach and last for only about an hour. So you're going to have the relief, you're going to have it fast, and that kind of thing. An H2 blocker can last for several hours, but PPIs, they can take up to 12 hours to activate, but their effects can last up to 3 days. And so this is why you don't necessarily want to do PPIs every day, because their effects last for 3 days, maybe even longer. And so you might want to see that you can take one every third day, take one every fourth day, and still have relief from your symptoms, because a PPI will last a little bit longer. Patients are often advised to take PPIs daily, and many of them take them for years and years. And this is what causes the long-term problems, including inflammatory gut issues. Now, I just want to come back to this little book. Okay, so this is one of my absolute favorite. This is called Thrive in 63. I love my Thrive people. They are absolutely amazing at getting the gut in line. And so if you have acid reflux, if you have gas and bloating, if you have all those kind of things, this is the perfect protocol for you, because it takes away the inflammatory processes in the gut. How does it do that? Well, there is an avoid list. I know you can't read that because it's all backwards and that kind of thing, but it comes with supplements. It comes in this beautiful box. It comes with supplements and the book, and recipes and a menu plan, diet plan, and that kind of thing, grocery list, everything that you need to change the pH of your stomach so that you stop having that GERD and acid reflux and that kind of thing. So we want to do that because we know that when the stomach is working correctly, right, all of your things, the rest of your body, your stomach is called your second brain. You have to have that stomach-brain connection in order for your body to work the way your body is supposed to work. So the Thrive in 63 program is one of the protocols that we use most often for gut issues because it just reconnects the gut to the brain, smooths out all those inflammatory processes, and things like GERD just go away. So that's really, really important. Dr. Rollins also found that many patients complaining of GERD often have unaddressed inflammatory gut problems. Once these problems are addressed by improving the diet for 6 to 12 weeks, our plan is 9 weeks, GERD symptoms tend to resolve and improve significantly, such as patients only need to take antacids occasionally when they eat something off the plan, okay? He also pointed out that although heartburn is often treated by reducing stomach acid, counterintuitively, heartburn may occur because of insufficient stomach acid. So I just want to address that. That is a condition called hyperchlorhydria. I had to practice for years to learn how to say that. That is when you do not have enough stomach acid. And as you age, part of the aging process is you do not produce enough stomach acid. Now, if you're somebody that's been on these PPIs for a long time, you may be doing this to yourself, but it is also something that happens through the normal course of aging. So we have products like this. This isn't the only product that is out there, but this is one that we have, and it is called HCLEs, and it is a supplement that improves the hydrochloric acid. Some formulas are called betaine HCl. Okay, you can find it all over. These are not things that you can't find. They're in every health food store. They're in every clinic. And if you are somebody of a certain age and you are having trouble processing your protein, you eat a steak and it just sits there and you're not able to, you don't feel good, you don't enjoy it because of all those kind of things, you could have that hypochlorhydria symptom. And if you increase your stomach acid, you take one of these with a meal. Okay, you don't just take it by itself because it increases your stomach acid. The stomach acid is there to digest your food. So if you're not having food, you don't want to take this. You only want to take this with your food. So when you're doing that, that's another option that you can do because quite a few people, especially if they're older, they don't have too much stomach acid, they have too little stomach acid, and oddly enough, the symptoms are the same. So I don't know how that works, but that's how it works. All right, the decrease in stomach acid can be the result of thyroid problems or a specific type of autoimmune disease in the stomach. Now, Jonathan V. Wright, who is the founder of the Tacoma Clinic in Chickwalla, don't know if I said that right, in Washington, specializes in natural therapies. He says that in his clinic, he's got a YouTube video, he says that 99% of his patients who experience heartburn suffer from insufficient stomach acid rather than excess. And I would say that we find this too. We find that the people that don't quite respond 100% to this program do, when we add this, that they have just a better response and they're able to do what they need to do without having heartburn all the time. So between the esophagus and the stomach is that ring of muscles known as the sphincter. This sphincter is the opening of the stomach, and it is responsible for closing the stomach to prevent undigested food and stomach acid from backflowing up into the esophagus. Heartburn occurs when this does not happen. We've already gone over that. So what do you do? Well, first of all, if this is something that is very severe, something that you've had for a long time, something that you suffer with all the time, I would say go to your GI doctor and have an endoscopy and find out, do you have ulcers on your esophagus? If you do, it is imperative imperative that you get that resolved before that turns into Barrett's esophagus, which is a precursor to esophageal cancer. If you do not have ulcers on your esophagus, yay, we hope that that's not what you have. You just have the acid reflux, then you can try the antacids. You can try changing your eating program with a plan like this. You can look at your stomach pH and find out where that is, because there are quite a few things that we can do to kill the bacteria that is changing your stomach pH, which is causing all of these symptoms. So this is why, or how, holistic medicine is different from Western medicine, is that we're just not going to give you a prescription to stop the symptoms. We're going to find out what the root cause of the symptoms are, deal with that root cause, and then the symptom is just magically going to go away. And that's what we want. We don't want you suffering. We want you to be able to eat your food, enjoy your food, do all the things that you need to do, live long, live strong, and not have any kind of sickness and disease. So if you have been taking PPIs for a long time, try spacing them out. While you're trying to get to the root cause of the problem, change your diet, get some good enzymes, get some good probiotics, get some good nutrition and supplements in there to try to alleviate that condition. Then you might not need your PPI because you have changed the problem with the pH in your stomach. So that's a lot. I know that's a lot. You can watch it again. You can share it. You can like it. You can invite your friends to watch it. All those kind of things. Thank you so much for honoring me with your time. I always find it exciting when people call and say, I just watched your video and I want to talk to you about XYZ, whatever we've been talking about. So it is Friday. That means it's the start of the weekend. So I want you to rest, recover, rejuvenate, change your diet so that you don't have acid reflux. And I will talk to you again next week.